Can persistent plunging clear tissue-based clogs reliably? Persistent plunging works because it repeatedly applies alternating pressure waves that loosen and break apart paper and fiber masses so they move past pipe bends and through traps. Start by using a cup or flange plunger that matches the drain opening, seal the overflow or secondary openings with a wet rag, and fill the bowl until the plunger lip is submerged to maximize pressure transfer. Maintain steady, forceful pushes and pulls of about 10 to 15 full strokes without breaking the seal. Then pull sharply to break a seal if needed and repeat cycles as necessary while watching for slow improvement. If no movement after several cycles, reposition the plunger slightly to change the angle of force and try again. For stubborn tissue clogs, use hot water that is below boiling to soften the fibers, pour it slowly while plunging, and avoid chemical drain cleaners since they can harden some paper products and damage pipes. If you have a hand auger or drain snake, feed it gently until you feel resistance, rotate clockwise to bite into the clog, then pull back while rotating to extract material. Sanitize the snake and run water afterward. Always wear gloves and eye protection when working on drains, and keep a bucket and old towels ready to contain spills. If you are uncomfortable at any point, stop and consider calling a professional plumber. Remember that most tissue and paper clogs respond to persistence and basic mechanical action, while true mechanical blockages like foreign objects will not. The three most common concerns are failure after repeated attempts, making the clog worse, and using the wrong tools. When plunging seems ineffective, the issue is often an unbroken seal or insufficient water level, so re-establish a tight seal, add water until the plunger is submerged, and try again with longer, uninterrupted cycles. If plunging appears to force the clog deeper, it is usually because the pressure is not being transmitted properly, so switch to a flange plunger, seal overflow openings, and try slow, steady strokes rather than violent jerks. When people grab chemical cleaners or an improper auger, they can damage pipes or compact material further. Avoid caustic chemicals on tissue clogs. Use hot water and a hand auger correctly. And call a plumber if the obstruction is a hard foreign object. BigHomeProjects.com helps homeowners find local contractors and compare options using reviews and project examples so we can make better decisions about when to escalate to paid help. We also help contractors find work by connecting them with homeowners and hosting a discussion community where we can all share tips, ask questions, and learn from real experiences.